I was a bit thrown for a loop when Jason asked me to speak at Stanford Department of Surgery Grand Rounds. It's a little overwhelming, a little intimidating to speak at the Harvard of the West Coast. Sorry, Jason. But what threw me for a loop more is he asked me not to speak about vascular disease. He said, nobody wants to hear what we're doing in vascular, so talk about something else. And I said, Jason, I've been practicing as a vascular surgeon for the past 25 years. I don't really know anything else whatsoever. I'm not sure what words of wisdom I have. So I turned to some of my partners at Mass General and said, what should I do? What should I talk about? What would you guys want to hear about? And so they said, oh, the best thing to do if you're looking for something to talk about is go to what you know. So look through your clinics and see if there's some interesting case that you could build a talk off of, which I thought was great advice. So in the spirit of Massachusetts General Hospital, I'd like to present a case record from the Massachusetts General Hospital, which is something historic we do there as part of our tradition. So a CPC, a clinical case presentation. So a couple presented to the vascular surgery clinic for evaluation. Their chief complaint was, will this work? How do we do this? Their symptoms were love, desiring matrimony. Their comorbidities, both were vascular trainees. They were different religions. They're multicultural, and they had shared values, but different family dynamics. And if any of the audience knows me, it sounds a little bit like my marriage, and maybe this is me. It's not actually. It's two of our integrated residents. So the gentleman is Dr. Sri Lelith, and his fiance at the time is Dr. Tiffany Belomo. And my response was, why are you asking me? Why are you asking us? We don't know anything about this. But we kind of do. They consider this a consult to the senior surgeons. So Dr. Srivastava is my wife. We've been married for over 20 years. We come from a multicultural background. We have similar values, but very different family dynamics. Her family drives me nuts. We have 2 children, but we're from a blended family. I'm previously married and divorced, and our daughter is from that marriage. We are interfaith. She's Hindu. I'm Catholic. Our daughter's Jewish. Our son is Andrew Charles, what we call Andrew Charles when we're angry with him or upset with him, which is a lot of the time. And he'll let us know when it's our business when he chooses a religion. That sort of sums up our son's attitude towards life. We are both physicians, both surgeons, both vascular surgeons, and we're both trying to navigate dual academic careers, which is extraordinarily difficult. We've survived a number of life events, such as having children and taking care of parents as they go on to the next life. And given this, some people think we have our business together. The reality is we have no idea what we're doing. We have no idea how we got here without everybody in our family being some sort of psychiatric disorder that we induced. This picture is actually from our wedding. We got married in 2022 at the Interfaith Chapel oh my goodness, I'm blanking on the place, the UN Chapel in New York City. It was a terrible time of year there, so they were thrilled to have a wedding. We were flanked on either side by funeral services for 9/11. The gentleman all the way to the left here without the shirt on is the Hindu priest that married us. We also had a Christian ceremony. That is me with the turban, and you'll never see that again. And this is my wife on the left. The Hindu priest is not wearing a shirt, but that wasn't how he was supposed to be. He'd arrived in the United States about 2 weeks prior to run a temple in Queens, and in his haste to get to our wedding on time, forgot to bring his shirt. So he couldn't have his, Ralph Lauren polo shirt on when he delivered our ceremony, so he did it shirtless. For my family, that was phenomenal because they thought they were getting a true historic Hindu event. No, it wasn't. He just forgot his shirt. So we haven't told them that yet, so they can still enjoy their memories. So I thought I'd talk a little bit about marriage and medicine. It affects most of us, but not all of us. But even if it doesn't affect you directly, it'll affect you if you have a training program. And when your young fellows and residents get married and they may be looking for advice on how to balance career and home. Some disclosures, as I said, I am divorced and remarried, and I have a daughter from that marriage that both Sunita and I have helped raise along with her biological mother and her stepfather. For some clarification during this talk, I did request some quotes and comments from a variety of dual physician families, trying to stick to dual surgeon families, actually. And these are people I know very well and was comfortable asking. Their specific comments will be highlighted in green. The quotes don't correlate with the pictures, so I tried to keep some of this anonymous, although some of them you might recognize if you're familiar with the individuals. I asked for one or two brief comments about what it would be like to be married to a physician or married to a surgeon, if you were to, or what it's like to be two surgeons in a household. And I said, just brief. I just want comments, and I got pages and pages and pages and pages. So this was really a hot topic for everybody, and they wanted to hear about it. Interestingly enough, and I didn't expect that. I thought we'd step back in the beginning and talk a little bit about marriage in the United States and what does that look like currently. According to the U.S. Census Bureau, as of 2024, there are about 62 million people who are married in the United States, which is a 20 million increase from the 1960s. We look at provisional marriage rates in the U.S. from 2000 to 2022, and it's taken from the U.S. Census Bureau. There's actually a slight decline in the rates of marriage that are occurring. We see a pretty big dip in 2020 for obvious reasons, but it was already on the decline. Divorce rates have not gone up, but they've sort of paralleled the marriage rates, and we've seen a slight decrease in them over time as well. If we look at 2022 specifically, which was pulled out of this CDC and database from the U.S. Census, the marriage rate currently is about 6.2 marriages per 1,000 population, and the divorce rate is about 2.4 marriages per 1,000 of the population. As I said before, divorce rates are declining. Again, another study from the U.S. Census Bureau. This is from 2008 to 2016. And we've seen in women a decline in the divorce rate about 10.5 per 1,000 down to about 8.2 per 1,000. And men about 10 down to about 7.8 over the past 8 years specifically. If we look at divorce and marriage stratified by age, marriage occurs more readily in the younger ages, as we might expect, and this decreases over time. And our divorce rates in the United States follow a similar pattern. If we look at the median age of the first marriage in someone's life, the age of that first marriage is increasing for both men and women. People are waiting longer to get married. Currently, men get married around 30 years old and women around 27 years old here in the United States. And the number of people who are never married by age, again, the percent that is never married is actually also going up over time. So there are many people who are choosing not to follow through with getting married. This includes domestic partnerships, by the way. Of interest to me and of interest to a number of people I know is the number of interracial marriages that are occurring in the United States. And we see the dramatic increase of that from about 3% up to about 19% between 1967 and 2019. If we look at the racial groups that are seeing these changes, it's really predominantly the interracial marriages are happening among the Asian population and the Hispanic population much more significantly than the white population in the United States. And if we look at it by what mixes are occurring, the most common intercultural marriage is the white male or female with a Hispanic male or female, and then followed by whites and Asians, and then whites and multiracial. Kind of an interesting evaluation. Marriage doesn't affect us emotionally. It's also an economic partnership. And that certainly has changed in the United States over time. And we see, and this does affect physicians who are married, which we'll get into. There are 5 basic marriage economic types. There's the wife is the sole breadwinner. Wife is the primary breadwinner, which means they make more than 60% of the couple's combined income. There's an egalitarian marriage where both of them make between 40 to 60% of the combined earnings. They're both contributing equally. Husband is the primary breadwinner. This is still the most common, with the husband making more than 60% of their combined income, and husband as the sole breadwinner. Who makes more, husbands or wives? In a growing share of U.S. marriages, you can see husbands and wives currently earn about the same. This is from the Pew Research Center. They did this analysis in April 2023, and they wanted to understand the role women and men play in the economics provided in opposite-sex marriages. And they used an American Trends panel. So we do see that wives' contributions to household income is increasing. Men do remain the primary breadwinner still, but women's financial contributions have grown steadily over the half century. And in fact, in opposite-sex marriages, the share of women who earn as much or more than their husbands has tripled in the past 50 years, which is great to see. There's been a decline in husbands as the primary or sole contributor, and the marriages in which the husband plays that role over the past 50 years has dropped from 85% down to about 55%. What about wives as breadwinners? Breadwinner wives are still in the absolute minority, taking part in less than 6% of the families. 10% of the wives are the primary breadwinner, but we see an increasing share of marriages where the wife is sole or primary breadwinner has increased from 1972 when it was about 5% up to 2023, where that's now 16%. Women who are most likely to become the primary breadwinner, if we look at an analysis of that, it's Black women, women with a 4-year college degree, and then in the age group of 55 to 64 with no children. So a little bit different population than we may have expected. Who works harder, husbands or wives? Now, this is a loaded question, I think. In egalitarian marriages, husbands spend more time on paid work and leisure than wives do. Jason's out playing pickleball. And then wives who are the primary earner in their marriages spend more time in caregiving and housework and caregiving and less time on leisure than their husbands do. So let's get into a little bit more detail. In egalitarian and breadwinner wife marriages, husbands spend considerably more time on leisure activities than their wives. Husbands in these marriages spend 3.5 more hours per week than their wives on leisure activities. And wives in these marriages spend 2 hours more per week on caregiving than husbands do, and about 2.5 more hours on housework. In marriages where the wife is the primary earner, husband's leisure time increases in that setting significantly, while the time they spend and dedicate towards caregiving and housework stays about the same. There are some benefits to a dual provider marriage in that they make more money. They make almost twice as much money as if the husband or the wife was the sole breadwinner for the family. So there are some perks to it. It sounds like there's some perks to it as well from a husband standpoint. It sounds like if I can get myself to not work, I'll have a lot of leisure time. Physician marriages, though, put a little twist on this. We have a lot more factors that may be influencing the stress in our lives if we're physicians that are married. So what does a physician marriage look like currently in the United States? And this is from a Scientific Reports in 2024. They did a cross-sectional survey of academic and private physicians in the United States. We found that about 86% of the physicians have been married at least at once. The average age of the first marriage for physicians is 27 years old, and the rate of first marriages ending is about 15%. For those physicians that are not married, though, almost 60% of them are involved in a romantic relationship. So they do have something that they would call a significant other. They're just not legally married. 1 out of 9 ever married physicians are married multiple times. So if you get married, get divorced, there's a good chance you're going to get married again. And 7 out of 8 of the first marriages, when they end due to divorce. The other 1 out of 8, they end due to the spouse dying. And we do find that about a quarter of the physicians in this group are married to another physician, so about 25% rate of dual physician marriages. Specialty selection had little impact on family size. That's true for surgery and medicine and family medicine, except for psychiatry. If we compare psychiatry to a number of other smaller specialties, they have less children. I won't make any commentary on that, but I'm not surprised. Marriage time, when they get married, really affects their practice settings, ultimately in their long-term career. And we find that if people get married prior to medical school, they're more likely to enter a private practice setting than they are to go into academics. Factors that are affecting marital distress and stabilization. You can see that it's stress from job, work hours, children, sex, stress from a spouse's job, a spouse's work hours, etc. And their stabilizing factors are communication, finances, children, and spouses' work hours and sex. It's interesting to me that children, finances, spouses' work hours can function both as a distressing and a stabilizing factor in medical marriages. Women, however, view this a little bit differently than men, and we found that spouses' jobs and work hours are viewed as a more significant stressor for women than they are for men, at least currently. Probably because the men can relax because they're going out to play tennis or something, and the women are just doing laundry. Divorce rates among physicians, sort of the end of the marriage, tired of it. We look at this from the US Census Bureau 2008 to 2013. They did a study looking at a large number of physicians and other healthcare related positions, and then they threw in their lawyers and other non-healthcare professionals. If we look at divorce rates among this group, as you'll see, divorce among physicians is less common than among non-healthcare workers and other healthcare professionals, interestingly, and that was a surprise to me. Significantly below, so physician divorce rates or divorce prevalence currently is about 24%. For nurses, it's as high as 33%, and for other non-healthcare professionals, it's about 35%. And among the physicians, the divorce prevalence was greater among women, and this was mostly influenced by work hours, and the work hours for women in particular. So how do we balance professional demands and marital responsibilities, and does any of that matter in our careers or in our lives? So who works more at home, a male physician or a female physician? This was a study, again, from 2003 to 2016, who's trying to address that issue. This was an American time use survey, as well as a nationally represented US Census administered survey of about 26,000 households, and they do this annually. What we find is that the age of they compared married physicians to married lawyers. The distribution of men and women is about equivalent. Age is very similar. The number of children at home who are under the age of 18 was a bit higher in the physicians than in the lawyers. The hours worked per week, about the same among the groups. And the spouse's hours per week that worked outside of the home, if they're a non-physician, is lower for men than it is for women in both the married physicians and the married lawyers groups. Female physicians with children instantly spend 100 more minutes per day on household activities and childcare than their male physician counterparts. Female lawyers with children spend 16 minutes per day than the male lawyers. And among the group of married physicians with children, married physicians without children, and married lawyers with children, women spent more time overall on household activities than men at a rate of about 103 versus 56 minutes per day. What activities were they doing when they surveyed them? Women were doing cleaning, laundry, cooking, and not in here, but also providing childcare. Where men were sort of the stereotypic, they were working on maintenance around the house and repair activities. Female physicians and female lawyers spent more time on childcare than their male counterparts. For female physicians, that was about 53 more minutes per day. And for female, I'm sorry, I have that backwards. For female, yeah, that's correct. For female physicians, 53 more minutes per day. And for lawyers, it was female lawyers, about 62 minutes extra per day compared to their male counterparts. What about dual physician domestic partnerships? So not just one physician in the family, but two physicians in the family. Let's make it a little bit more complicated. In dual physician families, an analysis of this is from the National Sample Survey of Physicians and the American Community Survey. When you see ACS over the next couple slides, it's not the American College of Surgeons. As we saw before, about a quarter of physicians are MTP or married to a physician. And in married to physician families, we find that about 3% of the partners are not working as a physician, even though they've trained and are credentialed as a physician. Females are more likely not to be working as physicians, 65% versus 35%. And more females than males are not working at all, despite having a medical degree at 51% versus 43%. Of those working in a non-physician capacity, about 3/4 of males are working full-time, and about half of females are working full-time. They're working, they're just not working as physicians. It gets a little confusing in here with all the physician and non-physician, but female married to physicians work about 3 fewer hours per week than a female non-physician physician. Male married to physicians work much different than that, about 0.3 fewer hours than a male non-married to physician. This doesn't make an awful lot of sense to me, but this is the outcomes that they found in their survey. The other ACS survey, it's very similar conclusions, which supported it. They saw larger between gender gaps for all of the groups, though. On-call probability, do the wives or husbands take more call? We find that male married to physicians had a 7% higher chance of being on call than male non-married to physicians. So if you're married, your wife's a doctor, you're going to take more call. Female married to physicians had about 28% lower chance of taking call than the female non-married to physicians, which I found absolutely surprising. I didn't think there would be a difference. If we look at personal income, again, the economics of being married. Married to physicians were associated with almost a $7,000 increase in annual income for males. If you're married to physician, this is associated with a $5,000 decrease for females when they control for work hours. So they're getting paid less for the same amount of time. Gender gaps are smaller for non-married to physicians than in married to physicians. And I think that's the last time I get to say married to physicians. This causes a lot of stress in the household. And it affects a number of items such as the family dynamics. And we do know that dual physician households face unique challenges in managing childcare responsibilities, household duties, quality time together due to demanding work schedules, long hours, and professional commitment. They require a significant increase in the support system. They have to have access to supportive childcare services. And as any of you have been involved in this, you'll know most daycare, if that's what you plan on using, open after 7 a.m. and they close around 5 p.m. That's sort of the national average. And that's not when surgeons are able to practice. I know most of our groups, their days start somewhere around 6 or 6:30, even out of training. And in training, they may start even earlier than that and stay longer than that. Does this have any long-term effect on the children's well-being? If you ask my children, they would say yes. But I think they're just being jerks. Because I think research suggests that children raised in a dual physician household may benefit from the role models of career achievement, academic success, and work-life balance. They may also experience some challenges such as time constraints, parental absence, and stress-related health issues. We did not luckily see many of that in our family. This is a picture on the top left of a little bit of our extended family. The fake blonde to the far left is my daughter, Emily, and she survived this just fine. She's a first-year law student at Harvard, and I don't think that shows that she's had any issues whatsoever. The goofy-looking kid who's second from the right, our right, that's Andrew Charles. He's a first-year undergrad at University and New York University. The other three people are nieces and nephews that we're very close with, but we're not alone. I think last year or the year before as speakers, it's Mal Sheehan and his wife, Claudie. They're both vascular surgeons as well, and this is a bit younger picture because their kids are much older now. Some of the comments we got from vascular surgeons or other surgeons that are married to physicians or married to surgeons, these are what they had to say about it. Communication, communication, communication. It's what makes it work. We need to celebrate our successes no matter how trivial. Children really complicated it. When it was just the two of us, we could steal time away together. With children, it's all about schedule coordination and forget time together. It does seem like that at moments. They have to make intentional choices, and it's hard, but it goes by quickly. Be mindful of the journey, not the destination. What about surgeon spouse and dual physician marriages? Does our persona as a surgeon have a negative or positive effect on being married to another physician in our household? This was a survey, a bit old though, but a survey that looked specifically at this is from American College of Surgeons. Julie Freischlag was the lead author on this from 2008. Almost 8,000 responding surgeons with a 32% response rate. About 90% had a domestic partner. 50% of the domestic partners did not work outside the home. Only about 16% were actually physicians, which is the group that we'll pay attention to more. And about 35% were working non-physicians. Surgeons in whom the domestic partner was a physician were typically younger, newer to practice, more likely to delay having children until after training, and believe that child rearing slowed their career advancement. Surgeons whose domestic partners stayed at home were more likely to have at least one child compared to two physician families, which has dropped down to at least 90% having only one child, and surgeons paired with non-physicians working a domestic partner, and drops even lower to about 88%. Surgeons who partner with physicians had a delayed child rearing, and typically, as I said, they waited until after residency. I'd like to see updated data on this because I suspect, at least from my personal observation, that this has changed in our world currently. Surgeons in a dual physician relationship often experience more conflict with their domestic partners than other types of partnerships. The conflict is career conflict and then work-home conflict, which are neither of those are surprising. Surgeons who are married or partners to another physician were more likely, though, to have depressive symptoms, lower mental quality of life, and this was compared to surgeons whose domestic partners stayed home. And so that's a little concerning when we think about wellness long-term for ourselves and our colleagues. Surgeons whose domestic partners stayed at home, though, were reported to be more satisfied with their career. And the surgeon-surgeon partnerships showed no differences in prevalence of burnout, high emotional exhaustion, high depersonalization, or a low sense of personal accomplishment. We just didn't see it because there were two surgeons married to each other. What are the perceptions, though, of dual physician, same specialty partners in the same practice, which also comes with it some really unique challenges and problems? The comments we get back on these are often viewed as a single surgeon or a single practice. You guys shouldn't complain about anything, someone quoted. You make twice as much as I do. That's not on an individual basis, though. That's the two people together making more than them. Your wife's patient came in overnight. You're their spouse. You should assume care of that patient since she's out this week. When you take a vacation together, too many people are gone. You need to rethink your work priorities. That probably went over great. You both shouldn't get bonuses or benefits or perks. The bonuses and benefits are to the family, not to the individual surgeon. I can't imagine that went over well either. I don't know where he is. I'm not his administrative assistant. I do believe that was my wife. And these are all taking place despite separate clinical practices, separate compensation practices, and similar work hours and call responsibilities among these groups. Other perceptions of this, again, there's Mal and Cloudy. They're very, very generous. We are all too familiar with the many struggles of a dual vascular surgeon family. You get double the call. You see each other more at work than you do at home. I might argue with that. And it is really difficult to establish an individual practice that is separate and unique from your partners, especially when being at the same institution. There was an additional on there, and especially being at the same institution where your husband is a world-famous vascular surgeon. That was not Sunita. You never have to explain how difficult a case was or how tiring and frustrating your day was. They just know. Middle of the night criticism, just get off the damn phone and go in. You know you're going to have to. You're just torturing me, and you're torturing me more than the resident. I might have said that. How does the impact of marriage, though, affect our ability to have career advancement for physicians? Is it a negative or a positive? Actually, it's a bit of a positive. This was a study done from Stanford University here. They interviewed 30,000 full-time faculty across all academic fields. And of that, they included about 2,500 medical school faculty that came from about 12 different academic institutions. About 73% of the faculty were in a dual career partnership. 41% of them had an employed partner, and 32% of them had an employed academic partner. The majority of the academic couples were related to the medical school faculty within those university programs, about 70%. This rate was higher for surgeons, actually, at about 83%. The 25% were in the same department, such as Sunita and I, or Mal and Cloudy, but this was lower among surgeons and only happens in about 13% of the cases. When we look at the outcomes of being an academic couple even in surgery, we found there's no differences between the faculty with academic partners and other faculties in terms of rank, the promotion to rank. That medical faculty with academic partners tended to fall into the top quartile of grant dollars. Women assistant professors with academic partners were also more likely to have achieved top quartile status when they compared them to the women assistant professors not in a medical marriage. Salaries were similar for faculty with academic partners compared to other faculty, and work hours were actually similar. Medical faculty with academic partners publish more. This is true for both men and women. In a fully adjusted model, having an academic partner was a significant predictor of productivity. And the average published article count among faculty with academic partners was 18% higher than their peers. What I don't know from this is that because both members of the partnership are writing more, or are they just sticking their partner on the publications they're doing with just a boost. About 25% of these were more likely to obtain a leadership position at their home institution, and married couples in medicine and married couples in surgery are viewed as being stable because it's extraordinarily difficult to find a suitable job for both people outside of the institution they find their first job at. And I can attest to that. Other comments about this is dual surgeon families are best avoided. I hope they're still married. She has the highest level of emotional intelligence, team building, and administrative skills you could imagine. I'm clueless. She should be the CEO is the next part of that. If we look at dual recruitment, 19% of academic couples had been dual hired. Faculty with academic partners are more likely to apply for other academic positions compared to their career peers, but often do not move, as I stated before, and can provide stability for a division or a department because they're considered a safe bet. I think for those that are married academic partners, you may lose some bargaining power because people think no matter what happens, you're probably not going to leave. Women associate professors had a 24% lower odds of applying to new positions than their male counterparts, and this goes up to about 43% for full professors. We have a term in there called spousal hire, but I think this is now these terms in here are actually considered a bit derogatory. Other names for spousal hires are the trailing spouse or the following spouse, which is not appropriate in my opinion. Along the way, you have to make medical compromise. Couples may make compromises that could disproportionately disadvantage one partner over the other, and this is potential for gender inequality in a setting that has already demonstrated a lack of women in leadership positions. Qualified physician spouses may not find their optimal employment commensurate with their experience or aspirations simply due to the lack of fit or desirable job openings. We try to overcome this with opportunities for tandem recruiting so that both people that are being recruited feel equally special at the institution they're going to. And that's me and that's my wife, Sunita. What about our path and what can I share personally about this? Making the decision to transition was always difficult. We started out, and my wife started out at the Cleveland Clinic. I actually did my endo fellowship there just to join her. I was in Michigan at the time. I did not want to go to Cleveland. I didn't think it was as good of an institution as the University of Michigan for what I was interested in my career. And I talked her into going to Michigan with me. That probably was a mistake. Michigan was not a good fit was a great fit for me, terrible fit for her. And then as a couple, it wasn't a very good fit for the two of us together, despite us loving Ann Arbor. And so we took an opportunity to go back to the Cleveland Clinic, which was a much larger organization, a much larger vascular surgery division, and it allowed us more opportunity to be flexible with our careers. We spent about 15 years there and then got recruited to go to the Mass General. So this was my turn to make the decision and decide whether we were going to go there or not. As Sunita had to help make the decision to go back to Cleveland. This was difficult, and it was more difficult because we had children at the time, where earlier some of the decisions was just us and we were pretty selfish about it, and could be. Where are we going to go next? I don't know. Sunita was interested in pursuing some chief positions around the country, interviewed for some of them, but with the recent changes at the Mass General Brigham, this is the MGH there though, but I'll take that off later and put MGB. With recent changes at the Mass General Brigham, we've decided to stay in Boston as there are phenomenal opportunities that were upcoming for her as well. Other opinions? This is probably many of you may know these people. This is John Rechtenwald, who is one of the first fellows I trained, but who now is a real leader in the world of vascular surgery, and his wife, Rebecca Minter, who is the chair of surgery at the University of Wisconsin. Other comments about this is there are no ideal jobs for both people. There has to be at least two good jobs, but partners have to be honest about that and not overcompromise. You have to keep your and your partner's priorities clear. What's important to each of you as an individual, what's important for your family and your marriage, if that's your biggest priority. But it is wonderful to have a partner who understands the ups and downs of what we do. We don't have to explain it when we get home. What about wellness and dual physician partnerships? Obviously is going to have a significant effect on our wellness. There's a book out there called The Medical Marriage, Sustaining Healthy Relationships for Physicians and Families. It's a pretty good book. It's a little bit outdated, published in 2000. The big message is medical marriages are hard and they're driven by additional stress because of our jobs. They said there's 4 classifications of stressors in the medical marriage: the anticipated but unavoidable, the unanticipated and unavoidable, the anticipated and potentially avoidable, but you chose not to avoid them, and then controlling yourself during uncontrollable times. I think that last one is probably where a lot of us live on a daily basis. If we look at the anticipated but unavoidable, 80% of the stresses we face on our day-to-day life and within our marriage are predictable. Some of these include the time commitment of medical training. You know what you're getting into. Early family life, often negotiated and we practice postponement of gratification. It'll get better next. It doesn't. We just develop different personal and professional commitments. If we look at our lifetime, and we as physicians have a lifetime exposure to pain, suffering, and death, which mutes our response frequently to our family and our loved ones. And medical partners in this setting often play the role of stress absorber, which adds their stress levels. The unanticipated and the unavoidable. We never anticipated it would be this hard. That should have been in green. Some unique stressors for people who are in a dual physician family. The overwhelming debt. If it's costing you $250,000 to go to medical school, you get married and you may now have a $500,000 debt at the beginning of your marriage. There are inflated costs of running a medical practice, decreased compensation, increased competition outside the marriage and within the marriage, especially if you are in the same specialty, in the same institution, working for the same recognition. We tend to adopt a disregard for personal health and fitness. We cannot ever leave work behind at the end of the day. We have a division of responsibilities in the home, and we didn't account for multiple jobs that we take during the course of our career. It's not just about being a physician. It's also being about a teacher, researcher, administrator, parent to our parents, etc. We were part of this group that cannot ever leave work behind. We talk about work at home incessantly, to the point that our children wouldn't eat dinner with us. It wasn't our cooking, because I tend not to cook and I order out, which is always really good. So they gave us a timer. And at the beginning of dinner, if we were all finally together at the same table, they'd set it for 10 minutes for mom, and then 10 minutes for me. You got to get it all out about work. And then when the timer went off, it stopped. It stopped until they were out of earshot. A great idea from them, and it actually worked a fair amount. We had a much better time at meals. I had a great time talking about business, but our kids didn't, and neither of them are going into medicine, and this is probably part of the reason why. The anticipated and potentially avoidable, but are not avoided. We are overambitious. As I said before, we have competitiveness outside and inside the family. We have a refusal to step away and enjoy life. We have a need for control because we have so little control about what's going on around us on a day-to-day basis. That develops some hostility and cynicism. And then we're constantly bargaining for delayed gratification. It will get better with the next stage of our lives. And as I said before, it doesn't. It doesn't get better after training. It doesn't get better after children. It doesn't get better when you make more money. Stress is still there. The challenges are still there. They don't magically disappear at any stage of your career. And as I said before, somebody commented before, enjoy the ride, it goes quickly. How about controlling yourself? How do we respond? And does that have a positive or a negative effect on our marriages when we're dual physician marriages? And it does. We have, as physicians and as surgeons, a learned stress response. And this can be misused by us when it comes to dealing with stresses and emotions outside the medical setting. And maybe why you're a great surgeon in the operating room, because you can manage that stress. But managing that at home or in interpersonal relationships may not always be so effective. We acclimate to toxic environments and ways of managing stress rather than changing things to live life in a more self-nurturing way. We practice noble versus normal. We think what we do and the sacrifices we make makes us noble, and that we should be appreciated for that by our families just as much as we may be by our patients, and that may not be true at all. And we have exceptional coping skills as physicians. We normalize an essentially abnormal life. The benefits of being in a dual physician partnership is the emotional support you get from your spouse and partner, and we've heard that along the way. Unconditional support, they know what you're going through. And you also have a sense of companionship, which contributes to higher levels of well-being among married physicians. There's a myth of a balanced life that we need to achieve. Many medical couples seek self-focused quest for increasing levels of satisfaction. And in order to balance this, physician couples frequently seek more appreciation from their families, more fulfillment, respect, and monetary rewards from work, and then more sexual fulfillment and intimacy in their marriage, more so than non-physician couples. For this demand for a balanced life, it may be really an unrealistic goal. And couples can fall into what are called super couple syndrome, where they think they can conquer the world together. The coping strategies in this situation often fail because you're not a super couple and you can't do it all. And there's the decline of supportive connections with the individuals you're trying to support. Here were our rules of engagement. When we operate together after hours, Sunita and I, we call it date night. I did find in Cleveland, though, if you ended around 3 o'clock in the morning, the only place to finish up that date night was at a Taco Bell. And so about once a month, we would go make a Taco Bell run at 3 o'clock in the morning. We have to set up rules for operating together, though. It's not as smooth as it would seem. One person is in charge, and we make that decision before we go into the operating room. If we tell one another, why don't you take a break, go get some coffee? It's really because we're annoying each other. And that's a hint that nobody's supposed to know about. That means leave me alone right now, come back in an hour and check on me. But if you don't leave now, I'm going to cut you with this knife. Maybe not that extreme. Our trainees did catch on to this, though, and they would call it mom and dad are fighting. Wellness in physician and marriages, despite this, it's not all hopeless. We did find from a JAMA evaluation that 65% of married physicians reported high levels of job satisfaction. And despite our troubles, if you ask me or ask any of the other couples that I queried, they all have wonderful careers and they have wonderful families. At least that's what they're telling me. But I think it's probably true. And that's higher rates of satisfaction compared to non-married physicians. This is another vascular surgery couple. They're from the Bay Area. That's Tim Shooter. And if you don't know, they're a senior vascular surgeon who used to be at UCSF. I think he's retired now. And his wife, Jade Hiramoto, who's on faculty at UCSF. If we do a comparison with single and divorced colleagues, 43% of married physicians reported feeling very happy at work. Again, a bit higher than single physicians. What about some of the ways we can approach our lives if we're married to a physician or surgeons married together? And this was a study out of the University of Michigan. They were looking for themes that came up as they interviewed couples who were either married to another physician or not married to another physician. And the intent of the study was to evaluate the challenges and strengths of dual and single physician relationship and assess for themes in these responses. Again, this is another dual physician family. I'll actually call them a dual surgeon family, and they're both vascular. That's Gustavo Oderich and his wife, Thelania. She's actually a vascular interventional radiologist, but she works a lot harder than he does. He travels a lot. And these are their two wonderful children and their Labradoodle, who I love. In this study, we found 4 themes that emerge. We rely on mutual support in our relationships, and this describes the reciprocal nature of emotional, mental, and occupational support the participants received and offered in their relationship as physicians. They recognize the important roles of each family member. They have shared values, and they acknowledge that the benefits of being a physician to a relationship outweigh the negatives. It's great to hear. There are some common practices that people have recommended to cope with the stressors. The biggest one is communication. The second one is looking at what some of the contributions to those outside stressors are and come up with a different game plan about how you're going to approach those, including cooking, grocery shopping, cleaning laundry, childcare support, which we already talked about some, and then other mundane chores. And try to determine if you can, because you do have some of the financial cushion of higher salaries that physicians may have than others in our communities, but what can be outsourced? Just don't outsource your family. Although if anybody wants me to outsource Andrew Charles, I'm happy to do that for you. You also have to carve out time for each night, for each other. Yeah, it's important to invest in that long term. As I said, date night doesn't always have to be over a case in the operating room. We did find, though, that when it wasn't, one of us usually fell asleep, which is only embarrassing if you're at a restaurant having dinner. And then it's also important to have a time away from everyone, not together as a spouse, but also away from your work, your kids, your family, and your spouse, and have time to reflect on you and where you're going with your life and touch base with yourself. Let's go back to the CPC. So this is Sri Lela and Tiffany Palomo. They're actually married in India 2 weeks ago. I mean, these are pictures they shared with us when they got back. They're wonderful people. Shri is going to go into a cardiac surgery fellowship in New York City. And Tiffany's just finishing her 3rd year in our residency and is going to be starting her academic development years in July. So why do we care? Well, senior physicians are role models of our work-life balance to our trainees. So I think it's important for us to think about and talk about these issues with them. We're not just training them to be clinicians, we're training them to live lives as clinicians. And they have to learn how to balance the demands of a challenging career alongside the challenges of marriage and challenges of family, and how that affects our outcomes in the hospital and at home. We understand the potentially unique aspects of physicians' relationships is necessary for their well-being and actually for our well-being. Just talking about it among our peers was a lot of fun and helpful. And we need to know this because we have more consults on the horizon for our vascular surgery marriage clinic. This is Ricky here, who's a first-year resident, and Bianca, who's also one of our first-year residents. And these are both of their husbands. I think we stole Bianca from all of you. But these are both of their husbands who are in medicine. Ricky's husband is just matched into an emergency medicine residency in Boston, which would make her life a lot happier and easier, potentially easier. And Bianca's husband, who they spent a good portion of the year apart, just matched an OBGYN at Mass General. And so we'll bring them back together, which will be very, very nice for them. I'd like to thank you for the opportunity to come here and talk about it. Jason, I hope I hit the mark you were looking for, talking about something that affects all of us, may be important to all of us, but is not vascular surgery. So thank you very much.